Welcome back, and we're going to look at the second principle here. The second principle I'm going to go through with you is breathing. Now, breathing is a very important part of your Pilates practice, but it's often the most challenging part of Pilates practice. So I want us to sort of concentrate on that today. So we're bringing our concentration into our breath work. Now, normally when we breathe, we don't think about it. It just kind of happens. But lots of us will shallow breathe. We'll just be breathing into the chest area. Some of us, if we're lucky, are breathing into the diaphragm and the abdominal area when we're taking deeper breaths. But for Pilates, because we are contracting our abdominals when we're exercising, which we will come on to on another day, because we're contracting those deep abdominals just gently, it means we can't take a deep breath into the abdominal area. So our breath has to come into our rib cage. We call it thoracic breathing. And so when we're hugging in around that center, our rib cage is expanding when we breathe in and collapsing when we breathe out. If any of you have experienced the old-fashioned bellows that they used to use to help get fires started, then our rib cage reacts very much like those bellows. When we expand the bellows, we're taking air in. So that's what's happening in your rib cage. They expand to the side when you're breathing in, and then they contract down, collapse down when you breathe out. That's pushing the air out for you. So if you can think of that as happening with your rib cage, that's how we're breathing with our Pilates exercise. So what I want us to do is just take a moment now and concentrate on the breath. When we start to put breathing with movement, we try to breathe out with the greatest effort of the movement. And you will discover that when we progress with exercises. But for now, we want to concentrate on getting our breathing technique coming into the thoracic part of our body. So again, we're going to take to our feet, we're going to stand up, and we can place our hands on our rib cage with the middle fingertips just touching there. So we have the hands just resting on the rib cage. The hand shape is then very much like your ribs. We're sort of keeping a rib shape. So we're nice and balanced on our feet. We're centered on our feet, which we did in the concentration part.